Hi everyone. Today let us study Cardiovascular System Guidelines with CPC Exam practice questions. The code range is 330162 to 39599. Today the topics covered will be anatomy of the cardiovascular system and pacemaker or implantable defibrillator guideline with example. So watch the video till the end. Let us study the anatomy of the cardiovascular system. This image is present in your ICT book, and also there is an explanation of cardiovascular system anatomy which you can refer during your exam if you get confused. And in your CPT book also, at the beginning of the chapter Surgery Cardiovascular System, you can find the diagram of anatomy. The cardiovascular system consists of heart, blood and blood vessels. So heart is a pump that moves blood through the vessels. So the heart has two sides, the right side and the left side. So each side has two chambers, that is right atrium, right ventricle, left atrium, left ventricle. Deoxygenated blood from the body returns to the right side of the heart and it is pumped to the lungs. In lungs, blood picks up oxygen and it releases carbon dioxide. So the oxygen-rich blood returns to the left side of the heart, and this part of system is called pulmonary circuit. Now the left side of the heart pumps oxygen rich blood to the body tissues where it unloads oxygen and picks up carbon dioxide. So the deoxygenated blood again returns to the heart to complete the cycle. This part is called as systemic circuit. The heart has four valves. Okay, so the first one is right AV valve, that is also known as the tricuspid valve. So it is located between the right atrium and the right ventricle. And next is pulmonary valve. So this is located between the right ventricle and the pulmonary artery. Next, mitral valve, that is left AV valve, which is located between the left atrium and the left ventricle. And next is the aortic valve. So the deoxygenated blood flows from right atrium to right ventricle to pulmonary artery. Then oxygen-rich blood moves from left atrium to left ventricle and then to aorta, where it is transported to the body tissues. Now let us study the heart wall. The heart wall has three layers. So the outer layer is epicardium. This is epicardium, which is the outer layer, and the middle layer is myocardium. So that is muscle tissue which is responsible for heart beating. Next, there is inner layer, that is endocardium. This lines the heart chambers and walls. So in your CPC exam, they may ask the question, the myocardium is thickest around which chamber of the heart? So the answer is myocardium is thickest around left ventricle, because this left ventricle has the pressure to pump blood into aorta and throughout systemic circulation. Now let us study the guidelines. So the first guideline is diagnostic procedure is always a part of surgical procedure. So do not code diagnostic procedure separately. Note this. Now let us move on to the important guideline, that is pacemaker or implantable defibrillator. Remember that the contraction of heart muscles is initiated by electrical impulses. So the heart generates its own electrical stimulation. So the impulses start from small group of cells called as pacemaker cells. So the primary pacemaker is SA node. So to study this guideline, first we should know what is pacemaker and what is implantable defibrillator. Pacemaker is a small battery device that helps heart beat in a regular rhythm. And defibrillators are devices that apply electric charge or current to the heart. So it restores the heartbeat to normal in case of rapid heart rate. So read this guideline. This is present in your CPT book, page number 240. A pacemaker system with leads includes a pulse generator containing electronics, a battery and one or more leads. A lead consists of one or more electrodes as well as conductor wires, insulation and fixation mechanisms. So here they have mentioned pulse generators are placed in subcutaneous pocket. Always remember that pulse generator means it is battery, and lead means it is electrode. Don't get confused with this, write this down. Pulse generator means battery, lead means electrode. Now let us learn how to code pacemaker or implantable defibrillator codes. So, to code, you need to check first whether it is single, dual or multiple chamber, and you have to check what procedure is done, such as insertion, placement, removal or upgradation. Let us check the codes. So, as I told, you have to check whether it is single, dual or multiple. So, a single lead means a pacemaker or implantable defibrillator with pacing and sensing function in only one chamber of the heart. Then dual lead means it is pacing and sensing function in two chambers of the heart. Then multiple lead, that is function in three or more chambers of the heart. These definitions are present in your CPT book, page number 243. So the codes are 33202, that is insertion of epicardial electrode, open incision. Then 33206 for insertion of new or replacement of permanent pacemaker with transvenous electrodes. This is for atrial, this is for ventricular. And 33208 for both atrial and ventricular. Then 33210 insertion or replacement of temporary transvenous single chamber cardiac electrode. That is a separate procedure. Next code is 33211 insertion or replacement of temporary transvenous dual chamber pacing electrode. Then 33212 insertion of pacemaker pulse generator only. So pulse generator means battery with existing single lead. Next 33214, this is upgradation. As we already discussed before, we have to check whether they are doing placement, insertion, removal, replacement or upgradation. So you can see here they have mentioned insertion, upgradation. So all these things you have to check while coding. Next is repositioning of previously implanted transvenous pacemaker or implantable defibrillator. And here there is insertion of single transvenous electrode permanent pacemaker, and 33217 for insertion of two transvenous electrodes permanent pacemaker. Then 33218, 33220, that is for repair of single transvenous electrode, repair of two transvenous electrode. Then you have relocation of skin pocket for pacemaker, relocation of skin pocket for implantable defibrillator. Then all these codes are for removal of transvenous pacemaker electrode, dual lead system. This is removal of permanent epicardial pacemaker, removal of permanent transvenous electrode. To be more clear, it is important to solve some practice questions related to pacemaker and defibrillator topic. So let's solve some questions. Read the question. A patient had a temporary transvenous pacemaker system inserted with electrodes placed in right atrial and ventricular chambers. How you should report this procedure? So, temporary transvenous pacemaker inserted with electrodes placed in right atrial and ventricular chambers. So, let us check option A, 33211. 33211 is for insertion or replacement of temporary transvenous dual chamber pacing electrodes. In our question also there is insertion of temporary transvenous dual chamber, that is right atrial and ventricular. This will be the right code. So we'll keep this option for now. Let us check other option also. 33208. 33208 is for insertion of new or replacement of permanent pacemaker with transvenous electrodes, atrial and ventricular. But this code is for permanent pacemaker. In our question they have mentioned temporary transvenous pacemaker system. So we cannot code the code for permanent. So we'll eliminate option B. Coming to option C, 33213, that is for insertion or replacement of temporary transvenous dual chamber electrodes with existing dual leads. But in our question they have performed temporary transvenous pacemaker system insertion. Okay, so we cannot code 33213, and also with 33213 they have mentioned 33208, which is for permanent pacemaker, right? But in our question there is temporary pacemaker, so we'll eliminate option C. Coming to option D, 33211, 33211, that is for insertion or replacement of temporary transvenous dual chamber pacing electrode. That is correct. But along with that, they have mentioned 33208. So 33208 is for permanent pacemaker and we cannot code it. So we'll eliminate option D also. We are left with option A, which is our right answer. So here the main term to eliminate the options was temporary transvenous pacemaker. The main things which you have to check is temporary pacemaker or permanent pacemaker, and you have to check whether there is dual chamber, single chamber or multiple chamber. So here it is dual chamber, that is right atrial and ventricular. Let us move on to the next question. A 68-year-old patient has dual chamber pacemaker. The leads in this system were recalled. The leads were extracted via transvenous technique. The generator was left in place and new leads were inserted via transvenous technique. How would you report this procedure? So here there are many codes, right? So let us check the first codes of each option. So option A first code 33214. 33214 is for upgrade of implanted pacemaker system. So conversion of single chamber to dual chamber system. But in our question, the leads were extracted and the generator was left in place and new leads were inserted via transvenous technique. So it is not the upgradation of implanted pacemaker system. So we cannot code 33214. Okay, so we'll eliminate option A because the first code itself is wrong. Now let us check option B first code 33215. 33215 is for repositioning of previously implanted transvenous pacemaker or implantable defibrillator. But in our question there is removal of leads and insertion of new leads via transvenous technique. So it is not repositioning of previously implanted pacemaker. Right? So we cannot code 33215 also. So we'll eliminate option B. Coming to option C 33208. 33208 is for insertion of new or replacement of permanent pacemaker with transvenous electrode, atrial and ventricular. 33208 code mentions insertion of new or replacement of permanent pacemaker. But in our question, only the leads were extracted, the generator was left in place and new leads were inserted via transvenous technique. So we cannot code for insertion of new or replacement of permanent pacemaker, right? So we'll eliminate option C. We are left with option D, which will be our right answer. Let us check how. Check the code 33235, that is for removal of transvenous pacemaker electrode, dual lead system. In our question also there is dual chamber and also there is removal of transvenous pacemaker electrode. You can check here. The leads were extracted via transvenous technique. So that is matching with our code 33235, and 33217 is for insertion of two transvenous electrodes, permanent pacemaker or implantable defibrillator. So here insertion of two transvenous electrodes is taking place. You can check in the question, the new leads were inserted via transvenous technique. So leads means electrode, right? So it is matching with our code 33217, and also they have mentioned modifier 51. Modifier 51 is for multiple procedures. In our question, they are performing multiple procedures, right? That is, the leads were extracted and also new leads were inserted. So it is a multiple procedure. So we have to code modifier 51. In option C also, these two codes are present. Okay, but here they have mentioned 33208, which is for insertion of new or replacement of permanent pacemaker dual chamber. But in this case, we have to code for removal as well as replacement of lead. So option D will be the right answer. You can also check other codes also if you want. That is 33218, 33216. All these codes are for repair and insertion of single transvenous electrode. If we code these codes for this question, it will be wrong. Okay. So we have eliminated all these options. Let us move on to the next question. Jerry, a 52-year-old patient, underwent insertion of permanent pacemaker with transvenous electrode placed in right atrial and ventricle. The pacemaker device was evaluated and then placed in subcutaneous pocket just below the rib cage. So here there is fluoroscopic guidance. So let us check option A, 33208. 33208 is for insertion of new or replacement of permanent pacemaker, dual chamber, atrial and ventricular. So in our question, what they have performed? Insertion of permanent pacemaker with transvenous electrode in right atrial and ventricle. So it is matching with our code 33208, that is for permanent pacemaker, right? So we'll keep this option for now. Let us check option B also. So here also they have mentioned 33208 along with 76000. 76000 is for fluoroscopic guidance. But remember, there is a guideline in your CPT book, page number 243. Radiological supervision and interpretation related to pacemaker or implantable defibrillator procedure is included in the code range. I will show you the guideline. This is present in your CPT book, page number 243. They have mentioned radiological supervision and interpretation related to pacemaker or defibrillator is included in this code range. So 33208 comes in this. So we need not code this radiological service, and here they have mentioned 93279, that is for programming device evaluation. But remember, radiological service evaluation of pacemaker is included in this code. So we need not code it separately. So by this we'll eliminate option B. And check the code in option C, 33217, that is for insertion of two transvenous electrodes, permanent pacemaker or implantable defibrillator. But in our question, they are performing insertion of a permanent pacemaker with transvenous electrodes. Okay, and under code 33217, you can find they have mentioned do not report 33217 along with 33213. So we cannot code these together. If we code this, it will be wrong. So we will eliminate option C. Coming to option D, 33211, that is for insertion or replacement of temporary transvenous dual chamber pacing electrode. But in our question, it is permanent pacemaker. It is not temporary. So by this, we'll eliminate option D. We are left with option A, which is our right answer, 33208. Let us move on to the next question. Read the question. Mr. Reyes had a temporary ventricular pacemaker placed at the start of the procedure. The temporary system was used as a support during the procedure only. How would you report the temporary system? Let us check option A, 33210. 33210 is for insertion or replacement of temporary transvenous single chamber cardiac electrode or pacemaker. Okay, so in our question also they have performed temporary ventricular pacemaker insertion, right? And in code 33210 also they have mentioned single chamber. So here it is ventricular, single chamber and insertion of temporary transvenous pacemaker. So it is matching with the question. We'll keep this option for now. Check option B, 33211. That is for insertion or replacement of temporary transvenous dual chamber electrode. But in our question it is single chamber, right? Only ventricular is mentioned. So if atrial and ventricular both are mentioned, it will be dual chamber. But in our question only ventricular is mentioned, so it is single chamber. So we'll eliminate option B. Coming to option C, 33207, that is for insertion of new or replacement of permanent pacemaker ventricular. But in our question they have mentioned temporary, it is not permanent. So we'll eliminate option C. Coming to option D, 33210, that is correct. And they have also mentioned 33207 for insertion of two transvenous electrodes, permanent pacemaker. Okay. And you can see in the question they have only mentioned temporary pacemaker and there is no sufficient information in the question to code for placement of permanent pacemaker, right? So we'll eliminate this option which contains the code for permanent pacemaker. We are left with option A, which is the right answer. I hope you're clear with it. Let us solve another question related to pacemaker and defibrillator. Before that, don't forget to show your support by liking, sharing and subscribing to my channel. Read the question. A patient required a battery change for single chamber pacing cardiovascular defibrillator system. The battery was taken out in a subcutaneous fashion and new batteries placed. So here the cardioverter defibrillator was then reattached to the electrodes which were intact. So how these services will be reported? Let us check the first code of each option. Option A 33244. 33244 is for removal of single or dual chamber implantable defibrillator electrode by transvenous extraction. So in our question, what they have performed? They have removed the battery. The battery was taken out and new battery was placed, and you can see here they have mentioned the electrodes which were intact and tested. So they have not removed the electrodes here. Okay, they have only removed the battery and replaced it. So we cannot code 33244, which is for removal of dual chamber implantable defibrillator electrodes. So we'll eliminate option A. So the main things you have to check for is whether they have removed the electrode, whether they have removed the battery. As I already told you, leads means electrode, pulse generator means battery. So here they have removed the battery and they have placed a new battery. So we have to code according to it. So let us check option B 33241. 33241 is for removal of implantable defibrillator pulse generator only. Okay, in our question also you can see they have removed the battery. Battery is a pulse generator, right? So 33241 is the right code. Let us check also 33240, which is mentioned with it. So 33240 is for insertion of implantable defibrillator pulse generator only. So here in the question you can see they have mentioned new battery is placed. So 33240 is for insertion of implantable defibrillator pulse generator only with existing single lead. So it is matching with our question. So option B is the right answer. We'll keep this option for now. Let us check also option C 33236. 33236 is for removal of permanent epicardial pacemaker and electrodes by thoracotomy, single lead system, atrial or ventricle. But in our question they have removed only the battery and they have replaced the battery. Okay, so it is not matching with the code 33236. So we'll eliminate this. And option D 33241, that is the right code. 33240, that is also the right code. They have also mentioned 33233 along with it. So 33233 is for removal of pacemaker pulse generator only. But here in the question they have performed, the battery was taken out from the Cardiovascular Defibrillator system, which is matching with the code 33241, right? Removal of implantable defibrillator pulse generator only. So we cannot code 33233. So we'll eliminate option D. So option B is the right answer. They have also mentioned modifier 51, which is for multiple procedure. So here multiple procedure is performed. That is, first the battery is taken out and new battery is placed and the cardioverter defibrillator was then reattached. So we have to code modifier 51. So option B is the right answer. I hope you're clear with it. In the next video, we'll study guidelines related to coronary artery bypass graft CABG guideline with CPC exam practice question as examples. So stay tuned.